Welcome, everyone. I am so honored today to bring a fabulous guest who is from Germany, right?
Yeah, I'm from Oregon, but I currently live in Germany.
Yes. So we are so honored that you are going to spend some time with us and talk to us about our lady bits, which is
Yes.
always a conversation that's a little bit harder to address. And since I'm an OBGYN, as we know, that all these things are open for discussion. So Dr. Bree is a doctor of physical therapy, a yoga instructor, a YouTube phenomenon. She has over 16 million views and over 600 videos actually on her YouTube channel. So there is a lot of wonderful information. An author and a podcast host and a mother. Like, you have every title that I could possibly give you, which is amazing. And she's here to talk to us about making our pelvis a priority and trying to work on pelvic health, which is hugely important for everybody, pre and post babies. And especially if you get into the lovely 40 category, it's super important. So thank you so much for joining us today.
Well, thank you, Dr. Jen. I'm so happy to be on your show.
Yeah.
Talking about my favorite subject, to be honest with you. I love talking about pelvic health. It is truly, it's truly my favorite thing to talk about.
So what made you so passionate about it? I mean, what is the backstory for why you decided to do this? Because this is not a usual thing for physical therapists to enter.
No, it's not. And especially when I entered into the field, it was actually 13 years ago, and it was even lesser known, I think, back then than it is now. But I had always been interested in, I'd always been interested in movement. I was never an athletic person at all. Terribly unathletic, in fact. But I did get into running when I was in high school. I could run. I could run straight ahead. That's pretty much all, but I could do that. So I got into running, and then in college and graduate school, I got into dance and different forms of interesting forms of movement. And so movement's always been a huge part of my life. And I thought physical therapy would be a great career for that. So I went into physical therapy and ended up going into geriatric physical therapy at first after I graduated. And then it just wasn't quite for me. And I got pregnant, and I decided to make a career change. So I switched to women's health, which had always been an interest of mine. But it didn't really become a passion until I actually started doing it. And first of all, until I started living it and had my own women's health, pelvic health issues. So that really cemented in my interest because, we usually teach what we know in some way, or teach what we've gone through in some way.
Yep.
We teach what we need to heal, or something like that.
Mm-hmm.
So I did have my own pelvic health issues that definitely cemented in my love for it. But then just working with patients who were dealing with these issues, that they would come to me and they would say, I had no idea that there was help for this. I had no clue. I feel like so embarrassed to talk about this stuff. I feel like it's gross. I can't believe I'm telling you this, but ... Like all of these things, and just being allowed to give these women a place to be seen and heard, and make them feel at home and make them feel comfortable and give them some help was so rewarding that it just cemented anything that had come from my own issues, that made me want to go into the field.
Yeah. And it's a subject that's very hard for women to talk about. And when they find somebody comfortable like you that they can reach out to, it means a lot. It really means a lot. And it's rare. I mean, I've been an OBGYN for 13 years, and it's rare that there's not a woman who has this issue at some point. Even if you don't have children, you still age. Everybody ages. And so this always comes up with, recognizing that lower back pain is really related to your pelvic floor, and recognizing that incontinence is really your pelvic floor. Like all these symptoms and stuff that comes up is your pelvic floor. And so it's hard to sometimes bring those things to a provider because it is embarrassing, and you don't want to have that conversation,
Yeah. And not often something that is talked about. I mean, the low, like you said, low back pain is can be very tied to the pelvic floor. And that's usually not something that's screened for in a typical office visit with a general practitioner. They're not necessarily going to go to that right away. And most people don't have any idea that could even be tied in. So I just think it's a conversation that not only is it embarrassing for some people, but it's just not talked about. It's not known about, that even there is such thing as a pelvic floor.
Yeah. And I find that in my practice, rarely do primary care providers connect that lower back pain issue to pelvic floor, because it's not really, I mean, in medicine, we have a broken system. We're not addressing it. Even in OBGYN, we're not addressing pelvic floor and how much prevention means for helping you long-term with your health. And so I think it gets kind of missed a lot. And I see patients who come in and say, well, I've seen my primary care 2 or 3 times and they can't figure out what's wrong with me. And rather than going to orthopedic and look at your back, you have to realize that your pelvis does all the work all day long.
It hooks everything together, and it
Yeah.
puts it all together, and it holds it all up. It's the stabilizer. It's the grand stabilizer. So yeah, the hips, the glutes, the pelvic floor muscle itself is the hammock, and it's hugely important.
Yeah. And I think, you being open to people discussing issues, especially prolapse. Prolapse is something that's hard to talk about. It's also hard to live with.
Mhm.
And some women, their older generation, their parents, especially their mother, are like, I dealt with it. You just deal with it. That's part of getting old. But we don't have to. We can actually do something about it.
Mhm.
So what do you tell women who are coming to you and talking to you? Like, what are some good tips they have for addressing their pelvic prolapse? And if you don't know what that means, it kind of basically when your pelvic organs start to relax, they cause pressure and pain. And so you have this feeling of something down there all the time, for those that may not know that.
Yeah, it's a feeling of heaviness and kind of dragging and pulling, and sometimes like a tampon is constantly stuck in your vagina is a way that it's often described to me, and something I've experienced firsthand. So there's so much that you can do, and my main battle cry, if you will, my platform, I guess I should say, is that it's so important to, first of all, trust your body if you feel like something's off. Because sometimes people will go to their provider and say there's something off, and their provider will say basically what you just said, kind of blow them off. Like, well, don't worry about it, or that's just normal, or I don't see a problem, But I think that there is, first of all, an element sometimes in the way people are examined. I think that if you're always examined lying down, and if the provider isn't having you bear down or cough or do something like that to see what exactly happens when you are messing with your intra-abdominal pressure, then it's often missed. And I advocate for patients to say, can you examine me standing up? Because that's another way to examine patients. Even though it's a little awkward for the patient and the provider, it's going to get you a better sense of how things actually feel for the patient. I'm not speaking to you, Dr. Jen. I'm speaking to people listening, of course. But it's, for the patient who may be working with a doctor who doesn't necessarily examine them standing up, I've actually encouraged people to ask their provider to examine them standing up, because that's how we live our day, is upright. And so if the doctor is open to that, it can be a helpful way to be examined. And if there is something going on, then what I encourage people to do is to, first of all, not just go straight to, oh my gosh, it's the end of the world. This is never going to get better, and life is over and I can't move anymore. Because a lot of people do go there and they think, I can never lift again. I can never squat again. I really shouldn't exercise. That's one route people go. And another route sometimes people go is immediately to surgery. And while surgery is certainly an option, and it's very helpful for some people, and it's, needed, and thank goodness for it, but it's not necessarily the go-to first line of defense. And I'm a huge advocate, as I know you are too, of conservative methods first. And so those would be, again, my little platform here is lifestyle. Lifestyle is really, really key. And it's not just about doing some Kegel exercises or some, strengthening program of some sort, although strengthening is certainly helpful, but it's about how you lift, how you stand, how you breathe, how you, carry yourself all day, how you move your body, how you poop, how you, whether or not you strain and push to poo, or, how you sit on the toilet when you go to the bathroom, whether or not you push to pee, because lots of people do, to get the pee out faster because they're super rushed and stressed and hurried. So they push to pee to get it all out fast. And that is everything I just mentioned there can be a problem if you're not doing it right. And nobody ever teaches us these lifestyle tips. It's not something we learn in school, and it's not something most of us learn from our mothers.
Yeah. And I think that's very common. People immediately hear it and they think, oh, I can't ever do anything again. I can't garden. I can't run. I can't do the things that I'm passionate about. And it's definitely, it should be something that you make adjustments, but you can still enjoy your life. And the data shows that people who do pelvic floor physical therapy before they have surgery have better outcomes, surgical outcomes, and they prevent long-term it breaking down. It actually works better. So I am a big advocate, and I never get offended if a patient sees me and said, I want a second opinion. Perfect. Do it. Like, you should make sure that you make an educated decision, because there are providers who are more apt to say, let's just surgically fix this and you'll be fine. And that's because we're sort of trained to fix things as physicians. We're trained, got an issue, fix it, done, walk away. And it's not really what a woman needs long term, because if they're in their 40s and they have prolapse, it's not going to last till they're 90. It needs to, you have to work on those things. Yeah,
exactly. Just the other day, a young lady had written me a message and said, she's only 26 and is considering surgery. And I said, well, you have to, it's a very personal decision, and you have to talk to your doctor and you have to do what you're going to do, but make sure you've exhausted conservative treatment measures first, because you've got a lot of life ahead of you. And
yeah, I many, many, many times tell patients, go do this 8 weeks of pelvic floor physical therapy and come back to me. If you want surgery, we'll do it. But just commit to 8 weeks and let's go through this and see what happens. Because a lot of things can be fixed from that standpoint for the pelvic floor. And you hate to spend all that time, and surgery is going to put you down for 8 weeks. So try to do something less conservative, more conservative, so that you can ultimately have a better outcome. I'm very much for trying the other options as well. And sometimes pelvic floor symptoms are so vague. Sometimes it's hard to know how much will be fixed with, like you said, a normal bowel routine. Like, let's work on the exit plan, because you may fix that and then all of your symptoms are better.
Yeah. Yeah. I had one of my patients, this is slightly different from prolapse, but she had urinary urgency and frequency really bad. Terrible urgent continence even. So she was leaking bladder. She felt like she had to pee right away and would, have to run to the bathroom and sometimes leak before she even made it to the toilet. But what happened is I discovered through our conversations that she was actually hovering above the toilet seat, even at home. Like, she wasn't sitting down fully to go to the bathroom, kind of like we do in gross restrooms that are public restrooms. We're like, I don't want to sit down on that. But she was doing it always. And just the simple act of convincing her, you really need to sit down all the way on the toilet, it completely allowed her muscles, her pelvic floor muscles and glutes and hips and everything to just relax and release. And that tiny change made her symptoms completely go away. So sometimes it is just a tiny thing, and you don't need, necessarily medication or surgery or anything like that. It can just be a teeny tiny lifestyle trick.
And, there are small lifestyle changes too. If you're someone who chronically coughs, or you lift at work, or you smoke, or, there are so many changes that can make a huge, huge difference. If you work on those small changes, you can often prevent a lot of pelvic floor symptoms, as well as just incontinence.
Yeah.
So tell us about your lift program.
Oh, so lift is my baby. This really is my baby. It's actually the program that I came up with. It combines lifestyle, like we've just been talking about, and exercise to create this really well-rounded program that helps women who have prolapse. And ideally, it really is for any grade or level of prolapse that may come to my program, something you can do at home from the comfort of home, which is really lovely. I encourage people to, if they can, seek the care of a women's health physical therapist who they can see one-on-one along with my program. It's not always possible, especially in these particular, times in history, but it's really wonderful if you can actually see someone in person and they can evaluate you and help you with your exercises through physical therapy. But that being said, it is an option too. If you aren't seeing a physical therapist, you can do it. It's very a guided progression of exercises that actually begins with releasing and letting go, learning how to identify, relax, and just kind of start mobilizing the pelvic floor before you begin strengthening. And then it's a gradual progression of strengthening that works not just the pelvic floor muscles themselves, but all of the surrounding and supporting muscles too. So the foundation is lifestyle, and then there's exercises, and it's a 5-week program. And basically it's it's the basic moves that I used for myself to heal my own mild bladder prolapse that I developed after giving birth to my son. Because I was going through the training of specializing in pelvic health physical therapy at that time. And so I was learning so much and I was jazzed about it. And I was so excited. I loved what I was learning. And then I developed my issue. So I thought, okay, I'm going to do something about this. And I put together something for myself, having no idea that 13 years later, it would be a program that I have and offer to people. But it's morphed over the years. I actually kind of came out with a original version 3 years ago, I think, that I made publicly available on YouTube for a period of time. And thousands of women went through this program with really amazing results. And I ended up taking all the feedback and kind of all of the things I've learned over the years. It's been a long time and I've learned quite a lot. And so I refined it and I've created this newly upgraded program that actually just launched. So the newest version of Lift is now out there in this world. And I have a very soft spot for this program because again, that foundation of lifestyle, the exercises, and then at the very tippity top is mindset. So I even include some guided meditations and affirmations for pelvic health. The mind and body, you can't separate them. So it's just a really well-rounded program and it takes people by the hand.
That's
which I
perfect.
think is what people need because they feel scared often when it starts. Mm-hmm. It's like, oh my gosh, what is happening? I am terrified.
Yeah, you don't know whether or not it's ever going to get better, right? Most women describe to me, as well as myself, having 4 children, I think, oh my gosh, am I ever going to have a pelvis that's back to, it's not me when I was 20, but definitely back to a level that you're happy with. I think I'm a strong advocate. Every woman who comes to see me and says, I'm done with my kids, I'm like, do pelvic floor physical therapy. Trust me, do something to get your pelvis back into order because it will make a huge difference long term. And what you said is amazing because honestly, everybody who thinks they're good at it, right? Everybody thinks, including myself. We had our ability to basically rent a machine that you can use and do pelvic floor at home. I thought it would be good. I teach everybody to do it all the time, all day long. I was terrible. The machine was like, you're at level 1. I'm like, level 1? I thought I was actually fairly good at this. I pushed 4 babies out of there. Nope. It's amazing how much you don't realize that you don't do those particular exercises very well. Mm-hmm. You don't hold them really. Most of it is because you don't hold it long enough to be useful. So I think there's so much that people can learn from a program that like yours because you don't realize what you don't know.
Yeah. Oh, exactly. Absolutely. Yeah. And also a lot of people are doing the Kegel exercise in particular incorrectly. Maybe they're squeezing their butt muscles mostly. I mean, they'll activate a bit and that's okay. But if it's mostly your butt muscles squeezing and your hips are lifting off the floor, if you're lying down, basically you're doing a bridge. That's not right. And a lot of people think that is. They're like, I'm doing my Kegels, but their hips are lifting up and down and or they're squeezing it, sucking in their upper abs. So they're squeezing in their upper abs and that's actually pushing down on your pelvic organs, potentially making things worse. So yeah, there's a lot to it, but it is very important to work this lower floor of your core is what I always call it. The pelvic floor, it's like the base, the floor, the basement of your core canister. And it's just key.
Well, the stronger you become in that area too, the better off the rest of it comes in, like your posture, right? You pay more attention when your pelvis is stronger. You don't sort of do the slumpy thing in front of your computer as much. You start to notice that other changes happen because of what you've done to focus on your core.
Yeah, exactly.
Yeah. And, you could be one of those people that does bar class all day long, the ballerina class, or you could do a 5-week program and learn how to use it within your own life. How to incorporate it. Because not all of us can go to bar class 3 times a week and get the same,
Well, and you can use the information you learn, this basic stuff about where these muscles are, and then get more out of your bar class when you go back. You can get an even better workout and a safer workout in whatever you do. That's ultimately my goal with my programs. And what I try to teach is not to constantly rely on like me and my workouts and my programs and stuff like that. It's to learn basic information that you can then apply to everything else you do in life, whether it's, moving a couch because you're helping a friend move house or vacuuming on a really heavy shag rug. It's really hard to vacuum on those. Or going to bar class or going to acro yoga or whatever, it's really, really important to be able to apply.
So I know you also help women with pelvic pain. What
Yes.
kind of programs do you offer, and what makes you kind of different, I guess, in that arena of helping women with pelvic pain?
Well, so one thing that I think makes me a little different is that I really think that basically everybody can benefit from learning how to release and relax first. If you sort of don't know what's going on, something's going on in your pelvic area, but you're not really sure what it is. Of course, see an amazing doctor like Jen, or see a pelvic floor physical therapist, or both, But I really think it's very important to actually learn how to release and relax, because releasing and relaxing the pelvic floor muscles is actually going to give you a good baseline, whether you have prolapse, bladder leakage, or pelvic pain or tension, which actually sometimes people think that if they have prolapse, then their muscles or bladder leakage, for example, prolapse or bladder leakage, then their muscles must be super like weak and lax and like long and droopy. But that's not necessarily the case. Sometimes it is, for sure, but sometimes the muscles are actually really tight and they're actually squeezing around and irritating the urethra that makes you feel like you have to always go to the bathroom, or irritating the bladder, or irritating or making the prolapse worse potentially, because the organs have descended a bit and then the pelvic organs or pelvic floor muscles are kind of squeezing around them. So tension can actually contribute to bladder leakage and prolapse just as much as weakness can. And if you can't see a physical therapist or a gynecologist who can help you tease out exactly what's going on, then basically it's a really safe place to start by relaxing. And then that's going to, of course, help people who need help with pain and painful sex and things of that nature that are causing a lot of issues, which is usually related to pelvic tension. So I really think that I don't like making blanket statements. I think everyone is so different, but I think for the most part, I do feel pretty comfortable saying relaxing is a really great place to start for almost everybody, just learning where these muscles are and then learning how to let them go. So to that point, though, I do have a program specifically for women with pelvic pain. I also have plenty of YouTube videos too. So I have loads of YouTube videos that are totally for free. I have a whole pelvic pain and tension playlist, but pelvic pain is something that can go along with things like endometriosis or adenomyosis, things that are, gynecological concerns dealing with your period. It can also be due to traumatic birth injuries that you had during delivery, other types of sexual trauma, sexual history things. There's tons of reasons that you can have pelvic pain and tension, pudendal neuralgia, just to name a few. But what can happen is your muscles can get really, really tense, really, really tight, and it can make it so that you feel constantly clenched. It can mess with your bowel movements sometimes. It can mess with urinary urgency and frequency, can definitely make it hard to have sex or put in a tampon, all these things. And it's just, it's awful. For a lot of women, it's quite debilitating. And people often feel very misunderstood, and they're told just to drink a glass of wine and get over it and have sex with their partner. Just relax, have a glass of wine, don't worry about it type of thing. And they feel very blown off. And so what I do for my programs is I focus primarily on, of course, stretches to release and relax those muscles, but a lot of nervous system down regulation, kind of calming the nervous system, because it's so stressful having a condition like this that it not only hurts physiologically, but it's stress. It stresses everything out. So it basically makes everything just go, just sort of zoom up, upregulate your central nervous system. And we need to focus on bringing everything down. So a lot of deep breathing, telling your body that you're safe and that it's okay. So we do a lot of relaxation work in my programs for that.
Well, and sometimes people don't know what started the pain too. I've worked with clients that, it's hard to get interested, right? If you know it's going to be painful, who wants to do anything that's painful? Like wine is not going to fix it. So we talk a lot about sort of, relationships and the safety of their relationship and that kind of component to make sure. But also some people just don't know what it is that caused it or when it started, or it's become such a, hard thing in their life. They don't really. And so I would imagine working on relaxation, working on being okay with yourself, being okay with what it is, it may bring out those answers as time goes on as well, right? Because you'll start to go, oh, wow, this started after I actually had my child. Maybe this is related to that. Because oftentimes I'll ask women, when did the pain start? And they can't necessarily, I don't know. It's just always been like this, And so sometimes it helps to sort of have the time, and something like this would be wonderful because they could spend some time figuring out where did this start? When do I have the most amount of pain? What, to kind of understand the cause, because it's hard. In a 15-minute doctor's visit, it's very hard to find out why why you have pain, because so many components come into it. Pelvic pain can definitely be associated with constipation issues, bladder issues, trauma. I mean, there's so many anxiety. Some people have terrible anxiety and pelvic pain. So it's difficult sometimes to piece it out without time. And I think that you're allowing a safe environment for people to have time.
Yeah, exactly.
To figure that out.
And a safe environment and at home, and you can feel a little bit maybe more comfortable coming into your body, because a lot of people with pelvic pain do kind of disassociate from their body. Like they don't want to feel that. Like you said earlier, that why would we want to treat this when it really hurts? And it actually can make you kind of not be able to be in your body, especially if you're maybe a little bit nervous with a provider right there that maybe who you don't know very well. So I do think that again, I just want to reinforce a billion times that seeing someone one-on-one is really, really important. It's nice to have backup treatment options or additional treatment options that you can do at home in the comfort of your own home at your own pace. And pause the video if you need to, and, slow things down or whatever it may be.
And understanding your body. That's a part that I think a lot of women, depending on, what conversations you had with your mom when you were younger, or your aunt or female, members, a lot of women just don't understand how their body works and how things are, and how they can. Oftentimes when I talk about incontinence, I'm like, did you know those pelvic floor muscles actually surround the rectum and the vagina? And it's all together. That's why you're having difficulty with constipation, because you're having, this is all connected. And a lot of them are just sort of like, really? I had, didn't know that. I just figured they were separate compartments. It's like, well, they're actually separate, but they're connected. So this all can go underneath one thing. So it's super important to understand your body and understand what it is that's causing you these problems. So I think that's a great, so you have a podcast, right?
I do. I have a podcast and I have a YouTube channel, and I put out podcasts and YouTube videos about once a week. I just really believe in putting a lot of free content into the world, because I just know there's different points of readiness and different entry points and different availabilities people have. And also I'm extremely prolific. Like I just love this stuff so much that I have so many ideas that I just can't even stop myself. I have constant ideas for new exercise routines that I want to put up on, or movement routines, I should say, that I want to put up on YouTube. And then I love talking. And so I have my podcast as well. So I have those, and I have a book, and then I have my courses.
We didn't even talk about that. I should mention that you have a wonderful philosophy about movement. That's something that really resonated with me. That's why I contacted you, is because I really believe that people should move every single day, and move and do things that you enjoy. Like movement is another word for exercise, but not using that word, because I feel like people often think, exercise is where I got to go work out at the gym and kill myself at the gym, and I hate it. But movement, and you're a big advocate of moving your body every single day.
That's my little tagline, is eat clean, move every day, shine brighter, because I truly believe that that's what saved me. I've battled with not only pelvic floor issues, but lots of depression and anxiety and a lot of mood stuff. And thankfully I was able to figure out some of my dietary issues that were contributing to gut health imbalances, which were impacting my energy and my mood and all of that. But then exercise keeps me sane, because I just tend to be kind of high strung. Like I said, I'm a content creation machine. I'm always thinking, I'm always going, and I need something to balance that. And so movement absolutely is my medicine. And I know that it helps so many other people too. And that's why I always say, I don't like calling it exercise. I call it movement. It's less intimidating that way. I mentioned at the beginning, I am not an athlete. I never have been, but I love moving my body. And I always like to say, date every form of movement until you find the one that you love. And then when you find the one you love, just know that it doesn't have to be a monogamous relationship, and it doesn't have to be long-term. You can play around the field a little bit. You can change your mind. You can try something new. But I mean, the key is just to not think that just because your neighbor loves to go on runs, that necessarily you have to go on runs. Maybe that's not your thing. Maybe you love swimming, or maybe you love whatever. Like, everybody has their own thing. Maybe you love bar class, like we talked about earlier. Maybe you love dancing. Maybe you love yoga. Maybe you love yin yoga. Maybe you love power yoga. Like, it's just a really nice idea to try out different things, because everyone's going to resonate with something completely different than somebody else.
Yeah, and things will change as you age. There's definitely, if you're focusing on weight loss, you have to mix up with weight-bearing exercise over 40, and there's definitely some things that have to change. So definitely you can be open to dating more than one movement.
Yeah. Have a little fun.
Yeah. We should always have fun. So if people want to find you, where would they suggest finding you? And I'm going to put a link to all of you have a ton of social media contacts, but where would be the best way for them to find you?
Probably on my website is FemFusionFitness.com. And then my YouTube channel has most of the content. I mean, I've been doing YouTube for a long time. So like you said at the beginning, 600 videos on YouTube. So that's youtube.com/FemFusionFitness. And then Instagram is kind of fun. I enjoy Instagram too. I'm just at FemFusion. I'm kind of FemFusionFitness everywhere. It's pretty easy. Yeah,
you've established a beautiful brand that everybody can recognize.
Thank you. Yeah, luckily it was 13 years. Well, it was about 10 years ago that I was able to get that URL snapped up. So it was before I got it early on.
Yeah. Well, do you have any other things that you want to discuss with our group, or anything in particular that I didn't mention?
Oh gosh, I mean, I could talk about this forever, but just have fun. I mean, that's the main thing. Start small and find something that you really love, and just move more throughout your day is, I think, the main thing. It doesn't have to be like a dance class or a yoga class or a run or even a long walk. It could be just, I actually just now, I stood up. I have a standing desk, the stand up, sit down desk. So I sit down for a while, and then I stand up for a while, and then I sit down and stand up, and I go back and forth. I think the more you can remember to every 20 to 30 minutes, move your body in some way, even if it's just for 30 seconds, it's going to make a profound difference in your energy levels and your health overall. So just move more.
Perfect. I love that message. That's a great way to end it. So we appreciate so much. I have loved our conversation, and I appreciate that you came and joined us all the way from Germany.
Yeah, thank you.
Yeah. And we will end our Facebook Live, and then we can chat a little bit after.
Perfect. Bye, everyone.
Bye.